This week's question comes from Steve Faibairn. I've been suffering with a groin and ab pain for about 3 months now and have managed to suffer the pain to do the runs I had booked, including the Great North Run and Trail Outlaws Wooler Marathon. I've finally succumbed to my male ego and went to the doctors who referred me for an MRI scan. I've been diagnosed with Osteitis Pubis, essentially an inflammation of the pubic bone and surrounding muscle insertion. I've been advised to stop running altogether in order to prevent a very lengthy period of recovery. My question is, what exercises can you suggest I could still do that won't aggravate my injury, and what exercise can I do that will help maintain a good level of fitness and waistline for when I return to running again? I've heard Aqua jogging is good, and I'm also looking into shockwave therapy to help treat the specific area. I'd normally be quite anxious about not being able to run, but I know if I recover properly, then I should be back to my running next year in a better position than when I started. My next major run is the Greener Miles Backyard Ultra in April. Love the podcast and Eddie's. I've edited what he actually said, but Eddie's dodgy Geordie accent. It was a swear word. It was a swear word.
Is he swearing at me?
Well, not at you.
Well, I'm going to set Dr. Rebecca on you now, Steve. Here we go.
Hi, Steve. As you say, osteitis pubis, essentially it's a condition of that pubic symphysis, which is the joint at the front of the pelvis. It's like a cartilaginous joint where the pelvic bones come together. It has not really much movement compared to other joints. And you get inflammation or sort of bone stress response in that bone, and also then you have a knock-on effect of the surrounding muscle insertions where those muscles go into that bone. The whole area is sort of unhappy. So it's an overuse injury. It's come from increase in load and the ability of those structures to tolerate that load. And then when you exceed that, you then run into something called the bone stress injury. So usually you are advised to have a period of rest initially, which is what it sounds like you've been done. And yeah, you're right. If you carry on running through this type of injury, then you can cause more damage, more serious injury, more significant length of time away from running because the joint essentially degrades, and then that can cause instability and problems within the joint itself. In terms of sort of what exercises to do, this really depends on why you had the condition in the first place. And always, I'm going to suggest in my answers that you see a physio for a complete assessment if you haven't already, because their remit is to identify the underlying factors which have predisposed you to this. So which bits of you are weaker than they should be, which bits are tighter than they should be, and therefore the exercises are then determined based on those deficits that you have, and that can be problems with the abdominal muscles, problems with the adductor muscles of the inner thigh, which is what brings your legs back together again. An imbalance between those two generally is what sort of causes a problem. So the exercises will very much be determined by any particular deficits you've got. And generally, you go through it sequentially. So you do exercise initially, which help reduce pain and symptoms, and then you gradually progress those depending on how you then respond and recover. It's not an injury that you can continue to run through generally, but that's not to say you can't be doing things actively to treat it. So have a period of rest and then a good period of active treatment, which should be overseen by someone who is used to dealing with athletes with this condition. So a good sports physio, rehab physio, those are the sort of go-to people for this to sort of take you through that return to running. There's some things that you can do for sort of cardiovascular fitness as well, but swimming, for example, we normally recommend for quite low impact CV, but in this condition, particularly breaststroke's very sort of aggravating to this type of condition. I'm going to let Eddie come in on the aqua jogging in a minute, but at the moment, so certainly swimming you might find aggravating, but other things, low impact cycling, if that's comfortable and it's not too stressful, those sorts of things you can still do. But the mainstay of treatment is working on the strength aspects of it. Other things, your physio will look at sort of range of movement in other joints and hips, whether or not there's any particular tightness in your hip range of movement, that sort of thing. So there'll be lots of things that you can do really actively to manage this. The other thing I'll just come in on is you mentioned shockwave. Shockwave is a treatment whereby externally you have, it's like a Theragun, if you you like, but it administers a particular dose of shockwaves to an area of the body. I haven't used it personally in osteitis pubis or bone stress injuries. It can be very, very painful, and it has to be a specific type of shockwave. But we use it in my role a lot for things like tendons. So tendinopathies, it responds quite well. And we think mainly what it does is it desensitizes the area so it becomes less painful, rather than it's some sort of magic that heals the area. Initially, when it was sort of brought out, that people were very interested in whether or not it sort of stimulated regeneration, growth, that sort of thing. But it probably doesn't work at that cellular level. It probably works by sort of desensitizing the area, so then you can do more rehab. Shockwave is always an adjunct. Okay, so it's always added on top of a comprehensive rehabilitation program. It's not a treatment in isolation. So if you see a physio and you're getting on top of all of that strength and conditioning work, and you're still getting pain and you really can't progress, then sometimes shockwave is added to allow you to progress. But it isn't a sort of magic bullet that's just going to take the symptoms and heal the area.
This question came in at the end of last year, end of November. Greener Miles, Backyard Ultra, it's quite a unique event. That's in April. Yeah, what's your thoughts on that?
In terms of timescale, if you have it aggressively, properly managed, so you are having regular input, then you can see some improvement and some return to running sort of after 3 months. 3 to 6 months really is the sort of timescale for this type of injury. But everyone's different, and it's very difficult to give timescales because some people are extremely irritable and everything you try sort of flares the symptoms. Other people, after a period of rest, are really good to go and really get on well then with the strength work. But you have to go through a period of strength and conditioning, then you have to go through a period of graduated return to run, return to impact, return to sort of plyometric explosive stuff, all that sort of thing. I would say a backyard format is a difficult format to make your first race back because it's not controlled for you. You can't sort of up your pace, slow your pace down as much as you can in maybe a longer ultra. Yeah, it would be a big ask to go from where you are November when the question came into April. That's quite a short time frame, but it really depends on how you respond in those early few weeks and months. But it is a difficult format, I think, to go straight into because of that sort of really repetitive nature of it and pacing and all that sort of thing.
I would think very wisely about doing that backyard ultra with all the stopping and the starting. And as Rebecca said, if you choose an ultra for your comeback race, which allows a little bit more hiking gently, you can run at your own pace, go for a finish rather than anything. And maybe in the summertime when it's warm as well, take out all the factors that could make you want to run faster, that could in any way hamper your, change your gait. So nice dry paths. And I would really focus instead on this first, perhaps you're back running now, first 6 months of a strength program, lots of cross training, working out, looking at a plan and what you did before that caused this injury. You mentioned about aqua jogging. I am actually giving myself the title of Queen of Aqua Jogging because I used it to great success when I had a stress fracture in my foot in June, and I ran 100-miler in October off the back of aqua jogging. So you can get yourself really fit with aqua jogging, but a caveat, it is the most boring thing in the world ever because you are literally going up and down a pool with no change of view. But I mean, you can make it interesting by getting to know all the old ladies that go in the lane next to you and the lifeguards, and basically you watch the world go by. I would suggest getting a pair of Aftershock earphones that you can download stuff into. So I put some music on so that I could get rid of the monotony, but you can do a lot of good work in the pool. It's great, even if you're back running, to swap out some running for aqua jogging because you have the resistance, but without the impact. And if you do it properly, you can have a really good workout, but without the knock-on of the impact. So you can go in and beast yourself aqua jogging, but you can get out and feel relatively okay because it's just not the impact. You need to choose sessions, if anybody's thinking about aqua jogging, is really short, sharp stuff. It's quite hard to get your heart rate up, but once you get your heart rate up, you can keep it up. So you want to do stuff like 20 seconds, 30 seconds, 40 seconds, and a really short rest. It also makes it more interesting as well. It makes the time go quicker. Definitely, Steve, I would take your time coming back from this, but if you can, aqua jogging could be your friend, and you might enjoy it as much as I did.
The one thing I would say is just it is hard coming from having an injury where you can't do what you love is super hard, and it's tough doing this this rehab stuff, nobody really likes it. Let's be honest. I don't tell any physios that, but it is hard. So, I would focus on the stuff you can do. Let the stuff you can't do slide for now. Just focus on what you can day by day. And, you have to keep looking forward, play the long game, which sounds like you're doing. So best of luck with it, Steve. And I hope you get back, fit as a fiddle.
Yeah, best of luck, Steve. And if you do toe the line, listen to your body, please. Listen to your body, don't. Because it's like Rebecca said, it's unique. You chasing the clock. You can't just slow down. That's it. It's a DNF. So yeah, be sensible.